Moffitt Cancer Center is an NCI-designated comprehensive cancer center. It means a patient coming to Moffitt Cancer Center can know that the National Cancer Institute has faith in us, and also knows that we have a balanced program that we're going to be looking at ways for them to prevent cancer, as well as cutting-edge ways to treat cancer.
One of the greatest, I think, strengths of the Cancer Center is in all the departments. Clinical trials is really set as a very, very high priority to be always looking for the latest, the greatest, and for some of these really innovative discoveries. Things which have shown great promise in improving patient outcomes, things that for some patients may be a glimmer of hope, something which they wouldn't have had access to. And really, in some cases, what we're seeing, especially with some of these new treatments, could be potentially opportunities for cure, things which for many instances was not even thinkable just a few months ago.
These tumors are very complicated sometimes, and through the combined work of the scientists, of us as clinicians, and the patients, we were able to sequence more of these tumors and to kind of decode the enigma of these complicated and sometimes very devastating cancers. And it is in our opinion that these tumors, they need to be treated in a multidisciplinary cancer center. And the same thing is not that it's just me treating these cancers. It's a team and a multidisciplinary team that we are looking at these tumors and diagnose and treat and navigate our patients through their journey.
Some of the trials we're developing are very innovative because we're looking at some new compounds, things that in the lab are showing some great promise, and we're combining them with other types of treatments which we know may be less toxic, or we're trying to see how we can change what I would refer to as the standard treatment, but potentially being more curative in terms of caring for your cancer. And that's always been an area of focus, and that's the ones where I think there's a lot of interest in a lot of our clinical programs to do that.
We learn and see the courage from our patients every single day. We are inspired by that, and I come to work with the same hope that how we can help these patients and together to walk through these challenges.
You never get we're not going to do anything. It's, okay, what are we going to do next? It's always, I'm going to fight. And at the same time, when you're taking care of those patients, it makes you that much more courageous to say, I need to be bolder and I need to be better. And I will tell you, as well as a clinician, you can never accept the status quo. I've got to do it better every single day.